Hey everybody, bringing you another exciting video talking about why healthcare fails. What are the components that give you care that is substandard, that does not result in the result or the prognosis that you're looking for, that the doctor is looking for. One main factor that is influencing your care that you have probably no idea that it is your insurance. Now, insurance is a very debated topic in politics and in the public sector, trying to figure out what the best strategy for paying for our health care is. Now, there's so many different types of insurance, whether it's federally run like Medicare, Medicaid, or private insurance where you pay money every month or you get it from your employer, okay? And that goes into your privately held insurance. Other people are self-pay patients where they don't want insurance. They'd rather pay for it themselves and stay healthy. So the statistics are quite staggering about how good the outcomes, the clinical outcomes in surgery are depending on your insurance. I was reading recently this book, The Cost of Cutting. It's a book written by a surgeon, just a general surgeon. And he tears into the details about how if you have Medicaid or Medicare and you go in for a surgery, you are 17% more likely to get a infection on the surgical incision, and I believe the percentage was even higher for an increased chance of death for surgery if you had Medicare or Medicaid, because Medicare and Medicaid traditionally spend about 29 cents on the dollar that we, the physicians, are billing to them. So just for a little example, let's say we build a $100 procedure. Medicare would traditionally pay us about 29 cents, or $29, excuse me. And Medicaid, it's even less. I've seen some that's low as 7% and somewhere as high as 19%. Okay, so for every $100 that we're billing, we're getting 7 to 19, or in Medicare's case, $29. So you can see how a doctor would be less focused, especially if it's a private practice, on your care if you have Medicare or Medicaid. Now, if you have private insurance, whether that's Blue Cross Blue Shield, Aetna, Optum, there's so many different, depending on which area of the country you're in, they're usually in the range of 50 to 70% of the return on what we bill. So, same example, we bill $100, they're paying anywhere from 50 to 70. I've seen somewhere up to 75%. So we're more financially motivated because we know that we're about to get returned on our investment. And healthcare shouldn't be that way. The doctors really shouldn't know those details, but you have so many people that are running a business that they have to know their numbers. If they don't know their numbers, they're going to go out of business very quickly. So how do you combat this? How do you get the best care possible if it's already predetermined by your insurance, the level of care you're going to get? A big option that a lot of people do, if you already have Medicaid or Medicare, is self-paying for your care. Hospital systems, doctors, physicians, urgent cares are a whole lot more motivated when there's cash about to be deposited in their account. They're willing to discount certain services for their self-pay patients. Now, if we have to bill insurance is the largest headache that a doctor or a clinic or a facility or hospital has to deal with. It's billing insurance, because insurance is always denying claims, sending back refusals of payment, and then they're going to cut the bill anyway. So if you're able to say, I've got $1,000 for your procedure, will you do my care? A physician, a clinic, a hospital is a lot more apt to work with you if you're going to put down cold hard cash. Now, if you are stuck in certain, Medicaid or Medicare programs, that is not the end of the world. However, you should be educated on your EOBs, or your explanation of benefits. You need to know which procedures these doctors are going to get paid for and which aren't. Because then you can have that candid conversation with them and say, listen, I know you're not going to get paid the full amount. How can I trust you that you're going to bring 100% of your skills to my care? But unfortunately, we don't ask those questions to our doctors. We don't put them on the spot and say, are you going to give me 100%? We just kind of expect it, not knowing that there are internal factors in the doctor's minds influencing how good of care he gives. Now, obviously, if there's a malpractice or if he does harm, I mean, there's some legal issues that you need to address. However, clinical outcomes show that even in situations that there is no malpractice case, the doctor's quality of care is slightly lowered when they know financially they're not as motivated as if it was a privately held insurance group or a self-pay patient. So those are my recommendations for you: knowing what you're getting yourself into, saving up money so that you can present cold hard cash or a direct payment. You'll have more leverage in getting the best physicians for your care and getting the best clinical outcomes. Hope this video helped. Hope to see you guys again in a future video.